I've been doing hormone optimization therapy now for a little over 15 years, and it's been quite a journey. I remember back in the day when I got started early in the 2010s, and it was very interesting. There were not a lot of people doing it. There was still a lot of apprehension about hormone replacement therapy, but gradually and gradually over the last several years, we've seen more and more positive press. And really, the tanker on the ocean has been turning around, and hormone therapy is now being recognized as a very important, in fact, vital part of aging in order to keep you optimized, healthy, vital, and active. More and more every day, I see things in the mainstream media, and I was looking through Fox News the other day, and I happened to see a really interesting article about testosterone for men. And for the most part, it was really encouraging and very positive. It talked about the need for men having hormone optimization. It talked about the gradual decline of testosterone over the age of 21 to 25 and how it goes down about 1 or 2% a year, and how that decline in testosterone can lead to all kinds of things which are along the line of sex drive diminishing, visceral fat buildup, subcutaneous fat, metabolic changes, weight gain, and all kinds of negative things up to and including diabetes and heart disease, dementia, and osteoporosis. So the decline in hormones over time can be really devastating to men. And now that we know, and it's more commonly accepted, that it's not just about sex, that it's about health and vitality, more and more people are doing it. I'd say more and more people are doing what I call drive-through hormones and just making people feel better, but not giving them the full metabolic benefits. But that's for another day. What I wanted to get to is, while it is widely indicated, and the article in Fox that I saw is generally very positive, it went off the rails a little bit toward the end when it started talking about the downside of testosterone therapy. And a couple of the things that really bothered me: sure, we can have oily skin, we can have changes in your hair and acne and a little bit of irritability. All of that stuff, we may not like that, but it's not dangerous and it's certainly not going to hurt you medically. What really bothered me is a couple of things that it talked about. It talked about the potential risk to prostate in terms of prostate cancer, and we know that is absolutely not true. Testosterone therapy does not cause or aggravate prostate cancer. In fact, the opposite is true. It is directly responsible for improving prostate health, and properly balanced men have lower incidences of prostate cancer. And if by chance they do get prostate cancer, it's far less aggressive and more easily treatable. The one that really drove me crazy, however, was the one about the thick blood. I hear this all of the time, and it's probably one of the most crazy things that I've heard. Well, testosterone does indeed cause what's called physiological erythrocytosis. What that means is that your blood count normally responds to the testosterone because you're healthier, you need more oxygen carrying capacity, and your body normally responds by increasing that oxygen carrying capacity by making more red blood cells. And of course, your blood cell count will go up. But the interesting thing is, everyday medicine is under the belief that that is something wrong with that. They call it this terrible blood cancer called polycythemia vera. And I go, no, it doesn't. The problem is that they go, yes, it does. And they go, see, and they'll give me these articles on polycythemia vera. I go, but that's not what he has. And then they'll go something like, well, we can't take any chances. I go, what do you mean you can't take any chances? They say, well, we can't take any chances. It might. And I go, it might, but it doesn't. And if it doesn't, it doesn't. What I want to see the receipt. That is, I got to see an article that says that giving testosterone increases the risk of blood clots or strokes or any of these things that people say come about from thick blood. And you know what? None of that exists. So until it exists, it doesn't exist. It's like asking, there's life on Mars. Of course there's not life on Mars, but someone will say, but there could be, but there isn't. Until you prove that there is, there isn't. It's the same thing with testosterone. There have been hundreds and hundreds, if not thousands, of articles going out forward-looking at testosterone. And there's not one single study that is a forward-looking study that looks at testosterone that has ever shown that thick blood causes anything or does anything. So if you've been on testosterone and your family doctor says, I'm worried about your thick blood, it is absolutely not true and it is not a worry. Give blood, donate blood if you feel it's your civic duty, but don't do it because you think you're avoiding a blood clot or a stroke. Testosterone lowers the risk of blood clots and strokes. It lowers the risk of heart disease. It lowers the risk of all hematological problems that are related to the blood count. So I wouldn't pay attention to that. So overall, I'm very encouraged that the data today is showing that hormone therapy is becoming more and more widely accepted. And if you feel that you're suffering from testosterone insufficiency, And it doesn't even require you to have a low number. It requires you to have enough testosterone symptoms to be encouraged about the possibility of relief from testosterone therapy. If you feel that's you, then you need to check it out. And we're always willing and happy to accept your phone call to see if we're a right fit for you. Dr. John Carrozzella from the Florida Center for Hormones and Wellness.